Okay, now we're going to do our cardiovascular exam, and so to get started with that, I'm going to just note the chest area, chest wall, and noting the chest wall again, there's multiple scars to the right upper shoulder, um, almost to the lateral aspect of the right upper chest. There's also a pain managing device with a significant scar across the top upper part of the device, and then also a scar that goes lateral. No other scars noted to the chest or abdomen area. There is a pulsation noted to the upper abdominal wall. No other pulsations that I can note. For palpation of the point of maximal impulse, to palpate for that, I would need to lay the patient down, but I can go ahead and try to do it going down mid-clavicular line, 5th intercostal space, and that pulsation is definitely noted. One, two, three, four, five. Okay, so now I need to do a check of pulses, and so to check, I'm going to try to do bilateral pulse checks. So up top, first checking brachial pulses. Radial pulses. Popliteal. One moment, I'm sorry. I have a message on my phone that I'm trying to clear. Okay. Posterior knee area for the popliteal. And then for the dorsal pedis, which is to go to the great and second toe, coming in, 2 plus, posterior tibial, 2 plus. Thank you, sir, for allowing me to remove your socks. 2 plus. So all peripheral pulses being 2 plus and full. Then at this point, I would need to, I'll start off checking cardiac sounds, starting off with the aortic first. The aortic heart sounds first to be checked. It will be 2nd intercostal space to the right sternal border. Pulmonic is to the left side. 2nd intercostal space, left sternal border. Erb's point. Third intercostal space, left sternal border. Tricuspid valve, 4th intercostal space. Apex of the heart, which is point of maximal for auscultation at the apex of the heart. Now listen with the bell for murmurs. Pulmonic. Aortic, I'm sorry, aortic is to the right. Pulmonic. Herb's point. Which is third intercostal space. Left sternal border. Tricuspid. Fourth intercostal space, left sternal border. And then apex, which is left midclavicular line, fifth intercostal space. S1 being best heard to the tricuspid area, which is fourth intercostal space, left sternal border. S2 is best heard over the pulmonary area, which is second left sided sternal border, intercostal space. Murmurs are best heard to the apex, which is fifth intercostal space, left midclavicular line. And heart sounds are S1, S2, no lifts or heaves, no murmurs that were noted. Normal, good heart sounds. Thank you, Mr. Lee.